it invades the cell. Oh, that's actually last year. Sorry, I need to change that. So last year's predominant strain was H3N2. I don't know what this year's going to be yet.
How do we take the shots?
They take a good guess as what they think it's going to be, but even they aren't sure. So actually, last year they got it wrong, and I don't know what they guessed it was going to be, but they guessed wrong, and it didn't provide great immunity. It still does, but it didn't provide as much protection as they would have hoped because the guess was actually wrong as to what the strain was going to be.
That guy get fired.
So there's actually 3 different types of influenza viruses as well. Influenza A can infect humans and animals. The most common animals are pigs, birds. Influenza B infects humans only. Typically, if you think about like the huge outbreaks that go across like a country or a continent, that's more influenza A. If you think about like a small little town that all of a sudden had an outbreak of influenza, that's more influenza B, for whatever it's worth. You treat them the same way. But, and then influenza C, it exists, it's out there. It really doesn't cause any problems, but it's out there. There's many subtypes. These viruses, they're constantly mutating. They're constantly swapping genetic material. And how you create a super influenza, like the one in 1819? 1918, yeah, 1918. The one that is you actually have a pig infected with like, how's it go? Yeah, so you have a human infected with like influenza B, and that human also gets infected with influenza A. And they get both at the same time, and the 2 influenza viruses start swapping genetic material, and that can create like a super virus, actually. So it happens about once every 100 years. If I remember correctly, that's how it works. But even without that swapping of material between the different viruses, just the influenza A or B or C, it just changes. Like its genetic material it's constantly changing because it's constantly trying to outsmart your immune system. Basically, is what it's doing. This might be a little too long. There we go. All right, what do I do, Mike? Or maybe it's just not one.
Influenza, or the flu, is a contagious viral infection that attacks your nose, throat, and lungs. It can cause fever, chills, runny nose, sore throat, cough, muscle aches, and fatigue. The flu virus is extremely small and only visible through electron microscopes. Inside the virus, genetic material contains the information to make more copies of the same virus. A protein shell provides a hard, protective enclosure for the genetic material as the virus travels between the people or animals it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. The flu virus uses its H spikes like a key to get inside your cells. N spikes allow copies of the virus to break away from your infected cells to infect more cells. There are 17 known types of H spikes and 9 types of N spikes that scientists use to name different flu viruses, such as the virus H5N1. You get the flu by touching an object that has the flu virus on it, or through exposure to body fluids from people or animals infected with the virus. When an infected person talks, coughs, or sneezes, droplets carrying the influenza virus may land in your mouth or nose and then move into your lungs. Once inside your body, the influenza virus comes into contact with cells in your nose, throat, or lungs. The H spike on the virus inserts into a receptor molecule on your healthy cell membrane, like a key in a lock. This action allows the virus to get inside your cell. Next, the virus travels inside a sac made from your cell membrane to your cell's nucleus. Then the viral envelope and cell membrane sac combine, allowing the viral genetic material to leave the sac and enter the nucleus. The viral genetic material hijacks the energy and materials in your cell's nucleus to make thousands of copies of itself. Some of the genetic material moves out of the nucleus, then attaches to ribosomes, which are the protein-building parts of your cell. Ribosomes use information from the genetic material to make other viral proteins, such as the H and N spikes. A packaging structure in your cell, called the Golgi apparatus, carries the H and N spikes in vesicles, which merge with your cell's membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then a new virus begins to bud off from the cell's membrane. During this process, the newly created virus gets stuck on your cell's membrane when a viral H spike locks on to membrane receptors. However, the virus has a way to get around this problem. The viral N spike frees the virus by cutting it away from the receptor. New influenza viruses are now free to infect more of your cells and cause you to develop the flu. If you have the flu, your doctor may prescribe oseltamivir, which you would take orally, or zanamivir, which you would take using an inhaler, to help speed your recovery or reduce your risk for complications. These antiviral drugs stop the influenza virus by blocking the viral N spike from freeing the virus. This causes the new viruses to stick to the surface of your cell so they cannot escape and infect more of your cells. The best way to protect yourself from the flu is to get the flu vaccine every year. You may receive the vaccine as a shot, which contains dead versions of several types of the virus. Or you may receive it as a nasal spray, which contains several types of live but very weak forms of the virus. The vaccine exposes your body to several types of the influenza virus that are too weak to cause infection, but just strong enough to stimulate an immune response. Within 2 weeks, cells in your immune system make markers called antibodies, which are specific for only the types of flu you were exposed to. The antibodies attach to each flu virus and prevent it from attaching to your cells. Antibodies are also able to attach to more than one flu virus, which causes viruses to clump together. Your immune system responds to signals from the antibodies by engulfing and destroying the clumps of viruses. Later, if you are exposed to these types of flu again, your body recognizes and destroys them, so you will not develop the flu from these same viruses. For continued protection against new flu viruses, you will need to get a flu vaccine every year.
Yeah, that's it. Let's go back to that. So influenza vaccine, they kind of talk about...
Any kind of flu could sweep the earth and leave dozens of millions dead. It's happened before.
There we go. All right, so the influenza vaccine, they kind of talked about a little bit, but the components of it, it usually consists of those H proteins we're talking about and killed virus. The nasal spray is a very weak version of the live virus. Yeah, so it usually provides protection from one of the influenza A viruses and one or two of the influenza B viruses, but they think they're going to be out that coming year or this year. However, virus mutation, which it does happen all the time, these viruses are constantly trying to change in order to evade your immune system. It can limit the effectiveness of a vaccine. And last year, it was only effective about 23%. Yeah, Susan, what's I thought? It's normally about 60 to 65% effective. So we'll kind of see how this year goes. Almost immediate mutation after prior year's vaccine had been developed. And scientists are attempting to make a universal vaccine and hope to have a universal vaccine within the next 5 years. I don't know if it'll happen or not, but that would be nice. So they mentioned oseltamivir, I've got a mess, but Tamiflu. So the mechanism of action, it blocks that N protein. It's effective to start within 48 hours of symptom onset. So that's the unfortunate thing. I get people coming in the ER with flu, and they've had flu symptoms for like 4 days. There's really nothing I can do. If you don't start these antivirals within 2 days of symptom onset, they're not effective. It's too late. They're just not effective. It will reduce the length of time that people are sick by a couple days. So even if you do get started on therapy quickly, it'll help, but it's only going to reduce the amount of time you're sick by a couple of days. It does reduce the risk of serious complications and hospitalizations. There's some benefit even after 48 hours in the elderly, especially in the elderly. So that's the one time I'll consider giving it to people, is if they're over like the age of 60 and you've got influenza virus. Even if it's been 3 or 4 days, I'll give it to them knowing it's probably not going to help them much, but I also know that their risk of mortality is a lot higher with their age group having influenza. So I'll go ahead and just try it and hope that maybe it'll help a little bit. That's about it. Any questions about influenza or flu?
When you say people die from flu, what is their underlying cause?
Acute respiratory failure, hypoxia, and then multi-system organ failure eventually. But yeah, it's usually a combination of flu and pneumonia. They just go into this horrific sepsis and die. And it's more common in the elderly who don't have as good of immune systems.
What would you recommend in the workplace as far as cleaning supplies during this flu when there's flu outbreak? Because a lot of people think bleach is the only thing that kill, or we don't all have website.
Oh, I see.
What do you recommend? Is there something that's better than others?
They're probably not that hardy as far as surviving any of those kind of cleaning agents.
How long will they last on the surface?
So this would be a guess. I want to say it's days, if not over a week, that it could survive. But that's on like a plane service. But if you give any kind of a cleaning agent, I don't see many viruses being hardy enough to survive something like that. So I don't think you have to go like straight bleach. But I think any kind of cleaning agent, probably strong enough to kill 99% of any virus.
Well, we're all exposed to a whole bunch of stuff, and fire departments and ambulance services and our hospitals, and so we all get sick more than others because of that. We're around sick people all the time.
The best way to help protect yourself, well, I mean, keeping the environment clean, that's definitely important. But probably even more important is keeping your hands as clean as possible. So I usually tell people, especially during flu season, or if they have a friend or family member with flu, wash your hands like obsessively, or get like the antibacterial hand gel. Like I said, virus won't survive something like that. Viruses aren't that hardy where they can survive one of those cleaning agents. And just use it a lot, especially if you're around somebody who's sick. It's not going to prevent you from getting sick, but it's definitely going to help out your odds of not getting sick. So I don't know of any special agent that's going to work better than others. I think most of them will probably do the trick just fine because they're just not that hardy.
Lysol works.
Yeah, there you go. I think Lysol worked just fine.
Well, I'm safe.
Not bourbons.
That's
That's what we're talking about.
a different kind of alcohol.